Hall & Wilcox acknowledges the traditional custodians of the lands on which this podcast is recorded. We pay our respects to their elders, past and present, and to all First Nations people joining us today.
Hello and welcome to our four-part series looking at the latest developments in health practitioner regulation across Australia. There is plenty happening in the space at the moment, including developments around medicinal cannabis, changes to vape laws, and updates to advertising and social media guidelines. So welcome, my name is Mitch Stein. I'm a partner at Hall & Wilcox in our Brisbane office. I've worked with medical practitioners and public health authorities for the last 15 years in assisting them through disciplinary matters and also civil claims. I'm joined also today by my colleague, Bridget Wall. Bridget, nice to see you.
Thanks, Mitch. I'm a partner in our general insurance team based in Brisbane, and I specialise in financial lines and professional indemnity claims. So I regularly act for allied health practitioners, as well as medical practitioners and healthcare provider organisations in relation to disciplinary and civil claims.
Thanks, Bridget. So our four-part series will be diving into some of the most topical areas for health practitioner regulation. In today's episode, Bridget and I will be providing an overview on recent prosecutions across the various state tribunals and some areas of focus for regulators which we have observed while assisting practitioners. We'll provide our observations on recurring themes present for practitioners and discuss what you need to be aware of and what you can learn from these latest developments that you can put into practice. In our second episode, we will be discussing medicinal cannabis and its changing landscape in Australia. Episode 3 will see us dive into vaping and the new laws which have recently come into play across the country. And in our final episode, we will review AHPRA's advertising and social media guidelines and discuss some of the recent cases in the space.
So I think it's a good opportunity to really set the scene and discuss, okay, well, what is AHPRA? So for those that don't know, AHPRA works in partnership with 15 national boards across the country to ensure that Australia's registered health practitioners are suitably trained, they're qualified and they're safe to practice. Public safety is AHPRA's priority and it guides their thinking in just about everything that they do. They do have a number of core regulatory functions. This includes professional standards, so that provides policy advice to the boards about registration standards, codes and guidelines for practitioners. Registration is another core function, and that they work in partnership with the national boards to ensure that health practitioners with the skills and qualifications to provide competent and ethical care are registered to practice. Another core function is notifications. AHPRA manages complaints and concerns which may be raised about the health, performance and conduct of an individual health practitioner on behalf of the board. However, in New South Wales and in Queensland, they operate slightly differently, where AHPRA only manages notifications that are referred directly to it by two of the regulatory bodies in each of those states. Another core regulatory function for AHPRA is compliance. AHPRA monitors and audits registered health practitioners to make sure that they are complying with board requirements. And a final core function of AHPRA is accreditation. And AHPRA works with accreditation authorities and committees to ensure that graduating students are suitably qualified and skilled to apply to register as a health practitioner. AHPRA also publishes a national register of practitioners, so that important information is available about individual health practitioners for the public. Over the last 12 to 18 months, across all medical practitioners and allied health practitioners, the most common and overwhelming concern is clinical care, such as inadequate or inappropriate treatment, other clinical care issues, as well as inadequate or inappropriate procedures. Other common areas of concern are communication, issues around appropriate dispensing of medication, documentation, and behaviour of the practitioner. The top 5 professionals that see the most number of complaints are medical practitioners, chiropractors, dental practitioners, pharmacists, and psychologists.
Just building on that, there's some stats from AHPRA from the 2022-2023 annual report, wherein there's 17,096 notifications were actually made about 13,500 practitioners nationally. And that accounts for about 1.5% of all registered health practitioners were subject to notifications. That number is quite significant in the professions. And so there's 9,706 notifications, and of those, 7,900 were dealt with by AHPRA. And then, as Bridget touched upon, the most common concern flowing from those complaints or those investigations were to do with clinical care. So matters involving 129 practitioners relating to 200 notifications were finalised before a tribunal, so they're the more serious in nature from the 2022-2023 year. And 98% of those resulted in disciplinary action, with disqualification periods of up to 25 years being imposed as the most significant. And what we see is that the matters that are referred to the tribunal, they're the more serious in nature, and we would expect quite a high percentage of the ones that the board do elect to pursue through the tribunals, resulting in some of the more serious sanctions for practitioners. Moving on to our first topic for today, and I'll put this question to you, Bridget, to start with. Over the last 12 months, what have you observed in practice while assisting medical and allied health practitioners in terms of matters before, in a disciplinary sense, that you've come across?
I should first off saying that in Queensland, we are a little different in that all notifications and complaints about practitioners that are made first go to the Office of the Health Ombudsman, and then OHO, which is what it's an acronym, the acronym for it, shares those details of the complaint and the notifications with AHPRA. And AHPRA and OHO take a joint approach as to determine, well, which one will stay with OHO and which one will go to AHPRA. It's about 50-50 in terms of how many go to AHPRA for AHPRA to consider and how many stay with OHO. Interestingly, the vast majority of those that are retained by OHO are actually unlikely to require further regulatory action. So that means that they assess them at that first preliminary stage, and then they determine that no further action is required. One aspect I am seeing is that most notifications and complaints will be dealt with at that AHPRA board or OHO level. Rarely are matters referred to the tribunal for a determination, and that goes to what you were saying before, Mitch. The ones that do go to the tribunal are of a much more serious or complex nature. Yeah. They typically deal with serious clinical care issues, repeated serious clinical care issues, so not just a one-off patient, but potentially a pattern of the practitioner allegedly falling below that clinical care standard. It can also deal with behavioural issues. They frequently get referred to the tribunal, particularly dealing with boundary violations, as well as I've particularly seen an uptick in matters being referred to the tribunal which involve the practitioner being non-compliant with their conditions. AHPRA and the boards take that incredibly seriously, where conditions might be imposed on a practitioner and they might have become non-compliant with them. The board will refer those matters off to the tribunal.
Yes, yeah. And have you seen, just reflecting AHPRA's data, your observations, you've seen clinical care as being one of the primary, I guess, subject matter for investigations?
Yes, it is frequently the number one issue that arises and is subject of investigation. And within that within the issue of clinical care, there's a number of different subsets in terms of inadequate or inappropriate treatment, issues around whether consent was appropriately obtained, and then also the issue of whether the actual treatment was performed competently.
Okay.
What are you seeing in New South Wales, Mitch, in terms
similar.
of?
And it's funny that you and I cover both the jurisdictions, which are a little different to the APRA regime across the other states. My practice in New South Wales, for medical practitioners and I assist a lot of pharmacists as well. I guess what they're saying with the council, the operation of the councils and the Ministry of Health, there are investigations ongoing in terms of competency of practice. And that's probably the bigger issue, and complaints arising not only from patients' complaints, but also complaints arising from the regulator. So the regulator conducting audits at in particular pharmacies and finding issues of non-compliance, legislative non-compliance there. So and they tend to be some of the more serious ones that derive from regulatory complaints, and particularly where you've got a host of non-compliance issues. I'm talking about the pharmacy kind of space here. They're ones where the council and the Healthcare Complaints Commission start to look quite closely at practices. And it's really about, and also I should say in the pharmacy space, there is an emphasis on ensuring appropriate proprietor oversight. And that stems from running the pharmacy, ensuring that standards across the board at your pharmacy are appropriate and adequate, and you've got proper policies and procedures placed there to ensure that your pharmacists are delivering safe care to the community, to the public. And as you touched upon earlier, that's the primary consideration for APRA in terms of regulating the health professions, is to ensure safe practice for all our health practitioners to the public. I will say that there has been use by the regulator in New South Wales of the immediate action provisions. So where conduct is sufficiently serious on its face, there are mechanisms available in the national law in New South Wales for the council to take steps to take immediate action against a practitioner, and that may be can be either to impose conditions or suspend a practitioner if the conduct is sufficiently serious as a matter of public interest, or if there is sufficient, if there is concerns for the safety of the public in terms of the practice while the investigation is ongoing. So I have seen quite a bit of activity in that space in the last 12 months. Again, predominantly in the health, my practice in the pharmacy space, but there has also been a few matters in the medical practitioner space as well that have touched upon that. And there are the themes and some of the subject matter. I think S8. So we've got opioid issues that are continuing and have been around for quite a number of years in terms of prescribing and dispensing. And we're seeing also medicinal cannabis more recently, and that's what we'll get to in our next episode. But there is a bit of I guess focus at the moment in terms of the regulator in that space.
Mitch, so you touched on there a couple of themes that you're seeing. So when you assist practitioners in the disciplinary space, can you sort of expand further on what other types of themes or issues that you see that tend to arise or reoccur?
Yeah, certainly. So I think what we're seeing is when a practitioner receives a notification, it generally derives, as I said, from a patient complaint or from a complaint from a regulator following an audit or an inspection for some non-compliance issues. And really the starting point is that there generally is a practice which on its face may be below standard or below the accepted standard for that practitioner. So it's really working with the practitioner at the outset to ensure we identify where that practice is and really get to the bottom of the issues that gave rise to the notification. It's really, I think, important for practitioners working through the process to engage with their professional bodies. They're there to assist them and really a very good educational resource for them to draw upon to reflect on their practices, to get some assistance in terms of the specialist area that they might be operating in. It's really important, and generally they're available to practitioners in the professions that they're in. So certainly leveraging off those organisations is very beneficial. I think working also with and utilising some of the publications from the regulators. to understand what they're looking at and maybe some areas to address or focus on. So in New South Wales, the councils generally release publications which are really helpful to review. There are, and that's from the HCCC, also from the Pharmacy Council, Medical Council, and depending on what other professions, the HPCA also has some guidance material available to it. I think one of the big, I guess, themes I see from a practice point of view is, and it recurs, and it has done so for many, many years, and it will continue to do so, unfortunately, is the practice of note taking. I find that is something, and I'm sure that as you know, as we all do in professional practice, you want to have the engagement, but then it's recording it kind of falls to the wayside a bit. So it's really working with practitioners to, if they can develop or improve that practice. And I think it really goes a long way to, I mean, from our purpose in terms of evidence as to what did occur at a certain time. But sometimes I find with practitioners, unfortunately, their records are quite lax, and it does present some challenges in trying to demonstrate what was occurring at the time, what was happening, what they were thinking, why they made a certain clinical assessment or judgment. So what one big takeaway, I guess, that I see routinely is improvements that need to be made to note taking, clinical note taking, and it's just, I said, it's a really good, it's best practice. It is what is required, but it also assists in allowing a practitioner to reflect on what has happened, to go back. There might be incidents that happen years after the fact, and there's a notification made 1, 2, 3 years later. It's very difficult for a practitioner to try to recollect what happened because they've had so many interactions since that time. Whereas drawing upon a note in a dispensary software or in a clinical management system is a much easier option to then refresh your memory and to get back into that space you were at the time of taking that note. So I think it's very important for practitioners to really and it's probably underappreciated, that note-taking aspect, but it is just so vital. It's so important, and it feeds into so many other avenues in terms of practice. So yeah, I think that's a theme that I see in terms of practice that the practitioners can really work on.
Can I jump in there and also say another theme that I think links in with the making sure that the clinical notes are there and well documented, is that I see a lot of complaints coming out of a real lack of communication between the practitioner and the patient. And it's about you sort of reflect back and think, if the patient's expectations had potentially been managed at an earlier point in time, then maybe this complaint wouldn't have arisen. So making sure that the practitioner, has the early discussions with the patient about what is the patient seeking out of this treatment, what are their expectations as to what they think will happen, and making sure the practitioner is saying, well, actually, this is what the treatment will and won't do, to make sure that the patient understands the limit of the treatment or the ability of the treatment to do X, Y, and Z, and then making sure that all of that is properly documented, as you said, because it's very hard to go back a number of years later and recall exactly what was and wasn't said to a patient without the benefit of contemporaneous clinical records.
Definitely. I think that's an excellent point in terms of the working with the patient to understand what how the practitioner can assist them is just so important. And really, that communication piece in any of the health professions is just so important. It's the engagement with the patient and working with them. It really achieves the best clinical outcome in terms of working with them to then achieve what they're seeking to achieve in terms of why they're presenting to the practitioner. Yeah, it's very, very important. And I think also one other comment I'll make is that the disciplinary process, and we will talk about now this more specific disciplinary process, a practitioner receiving a notification, that's questioning their practice, and no practitioner wants to feel that way or be in that position. But I think one big takeaway is that the process is not intended to be punitive. It's very much that the regulator is there to work with where there might be a deficiency in practice or a complaint arising from some deficiency somewhere in what's occurred previously. I think it's really working with the practitioner to address that issue or concern, work with them to improve their practice. I think that's a really important aspect of it. So that's not seen as being the regulator coming in and just putting a practitioner down further. It's about working with them to ensure safe practice. And that's really, if we can get into that mindset and take away potentially more the adversarial process which we might see in a civil case, we take that away and think of more of a collaborative approach. I think the practitioner certainly gets more out of it and is more engaged in the process. And generally, I think we do see better outcomes at the end of a disciplinary matter, where we've got a practitioner who's actually worked with the regulator, improving practices, and then we see a reflection at the end of an investigation where a practitioner says, actually looking back now, 12 months ago, I accept that my practice was substandard and there were issues here that have now been I've developed, and I wouldn't have gone through that but for this investigation. So I think it's a really good tool whereby practitioners, it's not the ideal. You don't want to ever go through an investigation or be subject to it, but I think it is, for those who do go through it, a very good point of reflection on their practice, and then being in a position at the end of the investigation where they're comfortable and confident then that their practices are at an acceptable standard, and it gives them confidence in terms of providing then services to the public moving forward. Next question I'll raise to you, Bridget, is following on from that, what are some of the things practitioners should have front of mind if they find themselves the subject of a disciplinary investigation?
I would say the first step that they need to take if they receive, correspondence or a letter from APRA or one of the other regulatory bodies such as the HCCC or OHO is notify your professional indemnity insurer immediately. The turnaround times for a response that APRA or one of the other bodies requires is usually around that 14 to 21 days. So it's really important that you notify your PI insurer immediately, and they will work with you and assist you in preparing a response to the investigation. If the correspondence from the regulatory body refers to immediate action, then you need to move very quickly.
Very quickly, yes.
Very quickly, because it's usually the case that the immediate action and the conditions that they're seeking to impose will arise within 7 days.
Yes, definitely.
Another thing that it's important for practitioners to keep in mind is to really understand what the APRA notification process is, because it actually can be quite long. Step one is that really preliminary assessment, and that usually takes place within the first 60 days. APRA will seek a response from the practitioner, they'll contact the notifier, they'll assess the risk, and they will determine whether immediate action needs to occur. Once that preliminary assessment happens, it goes to the board, and it's the board who will consider if no further action is required, or the notification can be completed with some action, such as a caution or condition or an undertaking, which will go on the practitioner's register, or the board may determine that further inquiries and investigations need to happen, such as assessment, performance assessment or a health assessment. And then it'll go back to the board for further consideration. And at that stage, the board will again consider whether it's suitable for a no further action. It could complete the notification again with action or a sanction, or it could refer it to the tribunal or for a further performance or professional standard. So the process can be quite long on a practitioner, and so it's important for the practitioner to reach out to not only their professional indemnity insurer, but also their professional body may be able to provide assistance in terms of responding to a notification. And it's also important to, these things can be quite stressful for a practitioner.
Yes,
no one
yes.
wants to have to deal with a complaint made against them. And it's important to reach out to those, to the relevant programs, such as an EAP program that might be available through the professional body, because these are very stressful events for practitioners to have to deal with.
Yes, definitely. I see that the anxiety receiving a notification as a health practitioner, I can imagine the anxiety levels are very high. And a lot of it is not knowing what's ahead, and I guess your mind always turns to the worst case scenario, and you think, oh gee, my livelihood's at risk here. What am I gonna have to do for a job? Look, I think it's about taking a step back, and it's very hard to do, easy to say, but take a step back, engage, make a notification, engage with the professional indemnity insurer, and get some advice. Speak to people who can advise you on the process, what's involved, and ensure that you're working through it step by step. And that's what I say to all the practitioners, one step at a time. It might seem like a very daunting process, the entire process, but just stepping through it, taking one step at a time in terms of what we're doing, why we're doing it, and then things will fall into a line after that. So I think that's, from my observation, the biggest takeaway is ensuring that, and I think preserving, when you receive a notification, preserving the information around that. So if you've got incident report, you've got records of what remedial steps you might have taken. This notification might have been 6 months after an inspection or a complaint from a patient. So it's about trying to identify, isolate those records, and then it said, as you said, engaging with your PI insurer, and whether that then obtains some legal assistance through them or separate legal assistance, whatever the case may be, to then work through and have a plan in place about what the investigation looks like, what the certain steps are, again, if we've got immediate action or not, and then through the initial assessment stage, what are the, what do we foresee being an outcome here, and can we try and resolve it through that initial assessment stage? If that's not achievable, then the investigation step, which you alluded to, and what's going to be involved in that. Will there be the performance assessment? And then again, whether at the conclusion of that investigation stage, where we're then heading. So it's really important, I think, to provide the practitioner some guidance on what's involved.
The vast majority of notifications, they have no further regulatory action required.
Exactly.
So you cut it off at that first step, but you put yourself in the best position possible to cut it off at that first step by engaging early, preparing a response. Speaking to your PI insurer to make sure that the response you provided is the best possible, so that it's either, whether it's OHO or APRA or the HCCC, they look at it and they consider your response, and they decide to take no further action. Moving now to civil claims. Mitch, what are some of your observations and suggestions for practitioners who find themselves the subject of a claim for compensation?
Some similar advice that you've touched upon from the disciplinary process. It's about preserving, firstly notifying your insurer immediately, so upon receipt. And there are, in the various jurisdictions, there are preliminary steps that can be taken. So requests for disclosure of records or clinical records. So that might be received prior to a claim actually being formally notified to you. So as soon as you receive that request with a seeking disclosure in the process of a claim then forthcoming, it's imperative that you, as a practitioner, inform your PI insurer at that point, and they can assist you with working through what is discoverable or needs to be disclosed in response to that request for records. And then again, various jurisdictions have different requirements in terms of what is then required to progress what could be a medical negligence claim, and that might be that you have to have a peer opinion report in terms of where that practice might have fallen below what was expected of a standard of care. So there are, again, each jurisdiction is a little bit different, but I think that the takeaway is that it's that early engagement again, and it's really preserving those records, ensuring that your insurer has all the material available to it and to yourself as a practitioner to defend or to work through, I guess, firstly, to understand what the claim is about and really determine what are the next steps, what are the best next steps to try and resolve that dispute. And some of them may be where something has gone untoward or there has been an adverse outcome. It's recognizing that and it's working with your insurer to try and resolve it with the patient, to try and put them back in a position that they would have been in but for what occurred. So but it's really sharing that information with your insurer, with your legal advisor, so that they can work with you try and resolve it as soon as possible. I mean, everyone wants to try and resolve things as quickly as possible. Again, that not have it hanging over you, both in a disciplinary sense and a civil claim sense. That no practitioner wants to have that kind of hanging over them in the back of their mind while they're still practicing. So, yeah, as much as we can to try and get on the front foot. That's probably my biggest suggestion.
Can I make one final suggestion?
Sure.
I would say also, whilst it can be difficult when you have a patient who's upset with you and wanting to seek compensation or making a claim for compensation, it's important not to make any admissions to the patient.
Definitely.
To not say to them, yes, I did stuff up or I did do something wrong. You can acknowledge the complaint that they've made and you can say, well, I'll take some advice and I will get back to you. So it's best not to make any admissions. It could impact on your defence later on.
Definitely, and there can be opportunities where, and errors occur. Like mistakes happen. Like that's part of everyone. Like we have to manage those, and it's just about the best way of managing those. And it can be if early engagement. It's about the communication piece as well. Once something from a patient's perspective doesn't go as they anticipate, or they've had an adverse outcome, it's certainly you want to work with the patient as a practitioner to make sure that and the first point of call is to ensure that they're safe, like the patient's safe. So let's say from a pharmacy point of view, we've got a dispensing error. The first thing to do is make sure the patient's safe before we do anything. We want that's the number one imperative. But once we've done that and we're comfortable that the patient has sought additional advice and be treated or whatever the case is, and they're in a safe place, then it's working back as to what the claim is about, and then how do we then go about engaging with that customer, that patient, to try and resolve. Again, it doesn't necessarily have to go to a legal channel. It would be if there's an opportunity to resolve a matter before lawyers become involved, great. That's a really good opportunity. But just getting that assistance from your insurer will really steer you through that process to achieve a quick resolution if we can, and also a reasonable resolution for all involved, which is really what we're trying to achieve.
Yep, they're good points.
Okay, that brings us to the end of the matters we were discussing today. Thanks very much for joining us, everyone, for the first part of our 4-part series. We've discussed a brief overview today of the practices across the various jurisdictions and some tips and some pointers for some practitioners if you are in the position of receiving a disciplinary notification or for some civil claims. We've scratched the surface, to be honest. There's a lot more detail we can get into about some of the things, but that's just a very high level overview of some of the things that certainly practitioners can be mindful of and give them a bit of an understanding of what's involved in these processes. So in next week's episode, we're going to be discussing the recent developments in the medicinal cannabis space. We'll be joined by a special guest to work through this interesting topic for practitioners. It's certainly been an area which has been thrust into the public spotlight in the last 12, 24 months. So yeah, you certainly want to join us if you can for next week's topic. As always, please get in touch with us if you have any questions. You can find our details on our website, which is Hall & Wilcox, HALLAND wilcox.com.au, or please connect with us on LinkedIn. If you enjoyed today's episode, then please rate us, review or subscribe to our podcasts wherever you get your podcasts. Thanks very much, Bridget, for joining, and look forward to seeing you at the next episode.
This podcast is not legal advice and should not be relied upon as such. You should always obtain legal advice about your specific circumstances.